We are live. Okay, good evening, one and all. I'm going to call this meeting to order. Thanks for all of you stopping by tonight. We'll start with roll call vote. A roll call. Elson.
Here.
Nystrom.
Here.
Pritchard.
Here.
Teban.
Here.
Millhouse.
Here. Well, I'm sorry to have to call this special meeting tonight, the Boone Community School District Board of Directors. However, we're starting to have some problems with COVID. Our district have been doing so well. Our students have been doing such a great job on social distancing, wearing their masks, washing their hands frequently, everything. And then, unfortunately, over the Thanksgiving weekend, we had a little lapse. And because of that, we need to be looking at what's going to be best for our kids and staff at the high school. With that, I'm going to turn it over to Ms. Treepa and let her give us some of the raw numbers and her recommendations.
Okay, and before I start with any recommendations or any of the numbers, I wanted to clarify, as I've had some recurring questions and concerns that have been brought to me from both staff and community, and I want to make sure that we're communicating very clearly with everyone exactly what the metrics are saying, as well as why the move to hybrid from the high school and not the district. So first and foremost, I will oftentimes get questions about the data that's posted for the day. For example, today's data was posted at 9 a.m. and oftentimes that may not match what someone knows personally from what happened today. And that's why on our metrics on the website, it states that the data is from the previous day's numbers. So that means Monday's numbers are really Friday's, Tuesday's numbers are really Monday's numbers, and so on. So I think it's important to note that we post by 9 a.m. on Monday, and the clinic doesn't open for testing until 9 a.m. So we aren't going to have today's numbers until tomorrow at 9 a.m. However, for tonight's meeting, we have gathered as much information as we have as of 7:02 tonight. So the numbers that I share, while they will be close to tomorrow at 9 a.m., anything we would receive between now and 9 a.m. based on today's numbers may be adjusted. So I just want to make sure everyone understands that the information that's posted on a daily basis is for the previous day. Secondly, another question that I have had, especially after sending out the survey the last time, was why did we move to hybrid for only the high school when the high school's numbers caused the district numbers to reach that 2.5% threshold? So in answering that, I want to just read the survey question that was asked on the survey. What was asked was, pending in-district metrics are similar across all buildings. Please indicate your preference in delivery model. And we did purposely state it that way because our intent and our actions the entire school year have been to provide the least disruption to our students' learning. If we can isolate the concentration of cases to a particular grade level or building, we do not want to move our entire district to a different learning model if we are only seeing cases in particular grade levels or buildings. And so that's why the whole district did not move to hybrid on Thursday evening when we sent that out to the high school, is because our district-wide numbers without the high school on Thursday night was 1.38%. And that's why we did not proceed to a different learning model at that time. So those have been the two most common questions. The information that I have to share with you this evening, and again, these are subject to change until 9 a.m. tomorrow, but the information that we have thus far is that tomorrow's numbers will show a total of 35 students that are COVID positive for the district. 29 of those students will be at the high school level. That means 6 students are positive throughout the remaining 4 buildings. And COVID with symptoms, we know of 10. We do not have, then that would be district-wide. So 16 students in the 4 buildings, excluding the high school. With the high school, they have 29 positive cases and 72 students that are quarantined. That includes those that are ill with symptoms and those that are just quarantined. So if you look at our high school numbers, we have 101 students who would normally be on site with us tomorrow if we were completely on site. And that would be 18.26% of our high school population that is not able to be on site. And so the concern then becomes our teachers having to teach in 3 modes of learning all at the same time. And so my recommendation for the high school at this time would be to go ahead and have 2 hybrid days so that we would have B, Green Day as scheduled tomorrow, and A day on Wednesday, so that we would have time to touch base with students, but to move to virtual Thursday and Friday, because we're missing almost 20% of our high school population. And then, in the meantime, apply for a waiver from the state to go virtual. I want to review the state's virtual piece, and because one of the pieces that has come up is, why do you keep changing things? Well, part of that is in a global pandemic, things change. And one of the things that has changed is the state's recommendations to schools as to what we should do in applying for a waiver. Our metrics indicate that the state recommends that the county be at 15% and our absentee rate be at 10%. And that has changed. That was what the state had shared with us at the beginning of the year, but the most recent guidance that they have shared with us is that if we have extenuating circumstances in our districts, like we do here in Boone with the high school, that we have the ability to apply for a waiver when we have such high concentrations in a particular building or in a particular grade level to go virtual. So that blue line is no longer as steadfast as it was when it was at the beginning of the year, which is why when you look at our metrics, the 2.5 to 10% says green and yellow, and it's kind of fully on-site or hybrid. Well, that's because our entire district's not going to a different learning mode, because we can isolate it to the high school. So we do have fully on-site as a district, but the recommendation would be to apply for virtual learning until December 22nd. So from the 14th to the 22nd. And we can go virtual for Thursday and Friday without a waiver, because we have been on site all last week and partially this week. You have to be on site for at least 50% of the time. And we can still accomplish that task being virtual Thursday and Friday while we await a decision from the state. So that would be my recommendation to the board at this time, and keep the rest of the district on site. unless we see our metrics tick up as a result of our high school.
Just want to verify, you said through the 22nd, the 23rd starts our break. Is that correct?
Correct.
Okay, so that would give them then until after the new year before to hopefully fix this problem.
Before they'd be in the classroom, correct.
Hopefully everything would calm down by January 1st and be able to go all kids back in the classroom as of January 4th. I think we come back, or the 3rd. 4th. 1st is on Friday. So that would be the goal, is to go for the 2-week time period through the end of this, through the Christmas break.
I would so move to her recommendation to go have the green day, blue, red day, whatever for Tuesday and Wednesday, and go completely online starting this Thursday.
And again, I just want to reiterate, my recommendation is just for the high school at this time. So if that's a conversation the board wants to have, that's
Yes.
fine. But I want you to know that that was where I'm coming from. And then the end date of the 22nd is because we won't have a need to be virtual during that break time, but that also allows, if our numbers go down, for us to be in activities.
I'll
If-
amend that to make sure it says for high school only and through the 22nd.
Okay, I have a motion on the floor. Is there a second to that motion?
I'll second that motion.
Okay, it's been moved by Mrs. Stevens, seconded by Dr. Nystrom, to have 2 hybrid days, i.e. tomorrow, Tuesday and Wednesday. Then follow that by online only at our high school through December 22nd. Someone's got their mic on.
Sorry.
Thank you. Any further discussion on this motion?
I have a question in regards to that structure front as far as activities. I assume that pushes it back as far as when those can be done. And then as far as coming back to in person on the 4th, what has to fall into guidelines for that to happen with being gone for those 14 days?
So the activities, if we receive the waiver beginning the 14th, there would be no activities from the 14th through the 22nd. We have been fervently trying to get a solidified answer from the state with regard to the answer as to activities over the break. But what we have gathered thus far is that if we end our last virtual day is on the 22nd, then we should be able to do activities following that. But we're trying to get verification of that.
Okay. And as far as what happens between the 22nd and the 1st, the public health department, they will continue to be getting names of kids who test positive and be notifying the school district of all those names. So that our school administrative offices will still be open over the holidays. And so they'll be able to track and make sure that our numbers are actually down by January 1st. If it's not looking that way, then we would have to meet probably January 2nd, January 3rd to ask for an extension. If that does not happen, but I'm hoping that if we do this now, we'll get this all cleared up. This little rash that we have in the high school, and the kids will all learn from this and exercise extreme caution in the next 3 weeks time, including over the holidays, as far as getting together in small groups at people's houses, even it's just 4 or 5 people when they don't have their masks on. All it takes is for one of those one of those kids to be COVID positive, and they all become COVID positive. I think I saw a number last week at Thanksgiving time, a week and a half ago, that said that in Boone County, if there were 10 people in the house unmasked, there was a 33% chance that one person in that house was going to be COVID positive. If you weren't practicing social distancing
wearing masks, etc. Then you got 33% chance of catching the COVID. Unfortunately, I'm afraid that's probably what's happened with some activities over the Thanksgiving weekend. We all have to learn from this and learn that if we don't listen to the CDC and the public health officials, there are consequences, and we're never going to get through this crisis. So our kids, our districts have been doing a great job up until now, and we're still seeing that great job in the elementary schools and the middle school. So we just need to get back to that task throughout.
There's also, with this proposal, I would also like for Chris or Drake to be able to share just a little bit about what that virtual looks like, because there will be a different schedule for a virtual learning. So I think it might be good to share that out for those that are listening currently. So I don't know who would like to speak to that. Chris, do you want to speak to that?
Yeah, that's fine. One of the things that we would try to do is we would run a 2-hour early release schedule online. That will cut our classes a little bit shorter and give some time at the end of the day for some study tables if we needed to, like office hours for our staff, and then also kind of a long extended power hour to check in with students. We'd also ask that in some cases our associates are going to be on site and helping facilitate that with our special ed students throughout the learning process. But we would run a 2-hour early release for our students during this time.
And that is just for the virtual learning, not the hybrid learning. So I just want to make that very clear. So the next 2 days, the students would be on site for the normal time frame. There is a different schedule they'll run while they're here, but that would be for virtual learning only. So I just want to make sure that people understand that. And we will also communicate this out after the board meeting as well tomorrow, so that people know what this means.
So now the other question, I'm assuming that this would mean that there would be no extracurricular activities or practices tomorrow or on Wednesday.
It would only be for Thursday, Friday, because tomorrow and Wednesday are hybrid and activities continue through tomorrow and Wednesday.
They will. Okay, so there would be games tomorrow night if there are any scheduled.
Yes.
Okay, Wednesday's church night, so.
Mhm. And they could continue through Friday because we're still meeting that 50%. It's only when they're on the waiver that the activities go away. So technically they could continue, but I think the only thing we have scheduled currently right now would be tomorrow night for games. They could continue through Friday because it's still technically 50% attendance. They only go away when it's 100% virtual on the waiver.
There was a question over here.
Yeah, I just want to make sure that I understand correctly. One of the biggest criticisms that I hear is that people in the community feel like maybe we don't follow our own metrics or rules. And I understand that it changes, but I want to make sure I understand that this recommendation is it based off of the quarantine plus the COVID positive, or is it based off of the COVID positive plus people that have symptoms? Our metrics define it as a, what does it say here? % of on-site population who are absent with COVID cases and or exhibiting COVID symptoms. I just want to make sure I can give people the correct answer when they call about that.
So it's kind of both in that, Jeremy, with when you look at the 10 to 15%, we're at 18.26%, and that does include just the quarantine students as well. But the state was saying if you have absenteeism above 10%, and we would have that even if you don't count some of the quarantine students. And it looks like Jill's got some more information to share. So I'm going to let Jill also piggyback on that, because we are trying very hard to follow these metrics. I think the confusion comes into the fact that the high school numbers are so high that it's driving our district numbers above that 2.5. And that's where it would appear that we're not following. But at the same time, we have said from the very beginning that if we can isolate it to a particular building, we would do so. So I'm going to let Jill piggyback.
Our metrics are really based on, I mean, what's on our chart is the COVID positives and the COVID symptoms. Now, those quarantine kids, I think at our last board meeting, you all indicated you just kind of wanted to keep a handle on that because that, while it's not a part of the metrics, it could weigh in when we get into that gray area. Because I know on the chart, there's a spot where it turns gray. And so, we've said that up until 2.5% in a building, we felt pretty comfortable being on site unless we could isolate that there was a grade level or something that really indicated it would make sense to be hybrid. After 2.5, it kind of becomes gray. And so right now with our COVID positive and students that are exhibiting some kind of symptoms, we're above 5%. We're between 5 and 6% just with the COVID positive and those with symptoms. So to me, that's pretty gray, right? We're above the 2.5. We need to perhaps make a model shift. What does that need to look like? And that's why I think we're bringing to you some of those other outside factors to help you make that decision, because you're in that gray area where it's not as clear what we should do. And so, the chart would say you're at 5.6% at the high school. What would you like to do with that? And I think that's where this recommendation comes from, bringing some of those other data points to you to help you make that decision.
Just a couple other things I'd like to highlight as far as that goes is, first, I think it's very important for our teachers, for the public to know that our teachers would have to be teaching 2 or 3 different sets of curriculum at the same time. There's the totally online kids, the hybrid kids. That's 20% of the kids to be hybrid, and the kids that are in the classroom. I'm sorry.
And quarantine
18.
kids have a different model. So it's really like 3 different models.
Right, that's going to put a big strain on our teachers, and we get that much strain on our teachers. There's not going to be a lot of consistency as far as the education. It's going to make it a lot tougher for our teachers. So that's one big key here. And the other big key you got to look at is that with hybrid, we say, okay, we bring in the kids every other day to keep the kids further apart from the teachers and try to prevent the spread. And the problem is the spread right now is because of things that happen outside of school. And so we don't know what those kids are going to be doing on the days they are not in the classroom on those hybrid days. Some wise decisions were not made last weekend, and so it makes it tougher for us to trust that would happen. So when you put those two things together, unfortunately, at the high school level, the way to get the best education, the recommendation from the administration is to do 100% online. And as I look at things, I would agree. I'd like to keep the kids in school as much as possible. That's why we're trying to do this by one building instead of all the buildings. Pat, you had a comment.
Yeah, I'd like to also mention for the teachers that for those that are on quarantine or whatever, there are some classes that were not online. And so the teachers, the third way is they're having to meet with those students individually. So they're having 2 sections of each class and having to track and make sure each of those with the hybrid, they've got those that they're meeting individually online because the class is not online already. And then the online students. So it just really puts a strain on those teachers.
I would throw in one comment also just in support of that, a lot of the changes that we've made or decisions that we do are based on what we know. And like I've talked about from the beginning, we've planned for what we thought it would look like. And then when we get to that, it doesn't feel a certain way or look a certain way. And so I would say we already did that in 8th grade when we went hybrid. And while we were able to isolate it to one grade level, due to the quarantine expectations at that time, I don't want anybody from our staff feeling like, hey, we did that and it was tough. I think that just reiterates that when that happened, we've all had discussions and said that was probably the hardest thing to do, was to teach in those 3 or 4 models to support all those kids. And so being that was the first time that we had to do that, we didn't necessarily anticipate how difficult that was. But because we lived through it and know how difficult it was, that's why we have the recommendation to not do that at this point, since we've already kind of lived that and experienced it. I just didn't want to diminish anything that our teachers had done to really give us the understanding and getting there of how difficult that really is. So again, a continual thank you to our staff and everybody's staff, but I don't want to diminish all the great things that everybody's done to, as we learn, we make changes and try not to be in the same situation to make it better for staff when we know we can do better. So.
And I'm assuming that coming back on January 4th, we would want them to be below the 2.5% before we would come back fully face-to-face. It could possibly be a hybrid at that time, or it could be fully, or we could ask for another waiver, depending on the numbers. Is that correct, Julie?
That would be correct. That would be why Brian talked about us tracking over the break. When others aren't on site, we still have the ability to track when people are not here. So if we do not see it trending down, then there would be yet another board meeting. You guys all love them so much. So we would have another board meeting to decide, because as of right now, the plan to come back on site on January 4th is given the idea that this will actually reverse the direction of our data and make it go down instead of back up, and that we would be below that 2.5. That would be the goal.
Okay, any other questions from anyone?
Call for the question.
Well, Brian, I have a comment. I'll just piggyback on what Scott said about our staff throughout the buildings. I got some very good input from our administrative team today, several members, and I appreciate that a lot. And everyone complimented their staff and gave me an opportunity to compliment their staff. They're working very hard to make school as great a learning opportunity as possible. And I think clarifying the descriptors from that survey was really important, because things are not the same, are comparable at each building. And so to differentiate now seems very appropriate.
Okay, thank you, Dr. Neisser. Any other comments from the gentleman here? Okay, we have a motion on the floor. The motion is to have hybrid days on December 8th and December 9th, and then go to totally online learning at the high school only through December 22nd. All those in favor, please signify by saying aye.
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 Aye. Okay. Opposed, nay? The motion passes unanimously. Okay,
As a reminder, we do have a regularly scheduled board meeting next Monday, and we'll bring updated numbers to that board meeting as well. That will be an agenda item just to update the board as to where we are by the end of the week this week. So do know that that occurs. If we see a big spike happening earlier than that, we may need to call another special board meeting, but I'm hoping that's not necessary.
what's another special meeting? We've had so many of them in the last 6 months because of this COVID. The regular meetings are the unusual ones now. So I'd like to thank everyone. Before we leave tonight, I just would like to make a statement, and I'm kind of changing hats now. As some of you on here know, some don't. I'm also chairman of the Boone County Board of Health, and I'd just like to make a little statement and educate people. COVID-19 has changed our world, country, state, county, and community upside down this year. One of the biggest losses in this past year has been the truth in science. When this virus was first identified, one of the first things that happened was the virus became political. Instead of following science as it worked to find ways to avoid the disease, treat the disease, prevent the disease, and cure the disease, the politicians got involved. This occurred at all levels, international, national, state, and local levels. Instead of an opportunity to learn the scientific process, political officials and the media have provided a steady dose of misinformation to all Americans. Unfortunately, many smart people in our nation, state, and community have fallen for this inaccurate information. Following this misguidance has led to COVID-19 spreading,
being around longer and causing death, financial difficulties, and impeding learning in schools. We will not be able to break this cycle until people get back to listening to the science and its guidance. Over the last 9 months' time, science has discovered many facts which can help mitigate this disease. First, face masks do work. While the CDC originally had some reservations about masking because of mask shortages for frontline workers, masks have been proven to prevent transmission of the virus. Not only do these masks prevent the wearer from transmitting the virus out to others in the room, it also prevents the wearer to a certain extent from getting the disease. Second, social distance does matter. Staying 6 feet away does decrease the spread of the virus. Third, avoiding large crowds prevents the spread of the virus. There is a reason these events are called super spreader events. Fourth, frequent hand washing helps. Many of these actions may seem uncomfortable or an impingement of our personal rights. However, it is time to what is the right for your friends, neighbors, fellow Iowans, and all Americans. All adults have a right to drink alcohol, but if they drink and drive, it is illegal as this impinges or causes a danger to their fellow human beings. The only way to bring this virus under control is to work together as Americans, Iowans, and Toreadors to bring the virus to its knees. Our medical community is getting tired and overwhelmed. They're tired of exposing themselves to the life-threatening illness because the patients have not listened to the experts, have done high-risk activities, and have become very ill, sometimes dying, with nothing we can do. Our school district this fall have been doing a great job with masking, social distancing, frequent hand washing, etc. Unfortunately, over the Thanksgiving break, we had a lapse in this great job. Because of all the misinformation, we had several students and families not follow the guidance. There were large gatherings without social distancing, masking, etc. Many very smart people listened to the pseudo information instead of the science, and now our district is in the very unfortunate position of having to keep kids out of the best place they can learn. That is the school buildings. We will get through this, but it will be much quicker recovery if everyone follows the science. First, wear your mask at all times when you're out in the public. Masks are in style and must be used anytime that you are in Walmart, Hy-Vee, Fairway, Casey's, school buildings, churches, etc. Maintain 6-foot social distancing at all times. Avoid any group of more than 6 people not from the same household. Wash your hands frequently. We must all work together to get the Toreador community, Boone County, all Iowans, and all Americans through this crisis. We can do it if and only if everyone cooperates with science. How can you recognize good scientific evidence? First, most all medical experts feel Dr. Fauci actually knows what he's talking about. Secondly, the Mayo Clinic, American Medical Association, American Common Family Physicians, and UpToDate are also very reputable sources. Despite some negative publicity, the CDC still provides very accurate, peer-reviewed, expert opinion articles, which most physicians look toward for advice in this battle. Together, toward our community, we will get through this crisis. The sooner everyone follows all the CDC recommendations, the quicker we will get back to normal. There is light at the end of the tunnel. Go Toreadors, mask up. And with that,
Hey, Doc,
I will, yes.
that your memo reminded me of something I've heard from several staff at the high school that maybe Julie can weigh in on. I think it's become progressively harder to get students to wear their masks properly. So maybe this break will be a really good opportunity to look at our policy, disciplinary policy on improper wearing of masks. And the second thing was, I heard that do students still have to quarantine if they're wearing gaiters or shields if they're exposed? Is that true? Do you think maybe after the break it'd be wise to require a face covering, and then have maybe a 0 tolerance or a 2-strike or 3-strike policy on disciplinary on that? I think that would ease a lot of concerns that some of the staff have been expressing to me recently.
That's a conversation that we've been having administratively, is how to have the higher compliance. And I did have a conversation with Dr. Melhouse about what the recommendation should be from the medical perspective. It is true that if someone's wearing a face shield or 1-ply gaiter, that they would have to quarantine, because that's not considered the same as a mask, or a 2-ply gaiter. And we do have some situations with our students with some certain needs that might require them to have a face shield versus a mask. So that's the reason it doesn't say face mask only. But we certainly have been exploring how we can restate that to encourage that with those that are not in those situations, if that makes sense.
Thank you, Jeremy. Any other comments? If not, I'll entertain a motion to adjourn the meeting.
This is Pat.
Move.
I move to adjourn.
Second.
Pat beat Jeremy. Ms. Stevens motioned, Mr. Pritchard seconded, motion to adjourn the meeting. All in favor, say aye.
Hi.
Aye.
Aye.
Opposed? Motion passes unanimously. This meeting is adjourned. Everyone stay safe out there, folks. Keep your mask on, and we'll get through